Assalamu alaikum, good morning.
And Walaikum salam and good morning to you as well.
Welcome to our show once again. Not once again, I think it's your first time.
Yeah.
So, can you tell us the global burden of female genital mutilation and also how many women are at risk and what is the cost of it and just a general overview
Sure.
of it?
So, Tahani, thank you. And I think you very rightly mentioned that earlier we have recorded a podcast on the burden and the issues related to female genital mutilation. FGM is really a very serious problem, and it's mostly carried out in countries of Africa and also common in South Asia and Southeast Asian countries as well. And you will find such cases also in the immigrant populations, the populations who have moved to, say for example, to UK or to Australia, you will find the FGM women there. And since they have passed law now to stop this practice, these people will move back to their country of origin and get their young children have this FGM. So that is a constant struggle between, I must say, between the cultural practices and saving the this mutilation of young girls. So this practice occurs in young girls from infancy till age of 15 years. And it's very deeply socio-culturally enrooted practice. And in most of the countries, it is also related to the religion. And people have tried to look, and they have researched, and it's very interesting research if you look at the origins from this, where this has originated, like anthropological research and also the historical research. And they would say that this practice was prevalent even before the Christianity, era of Christianity and the Islam coming in. And that was mostly done on female slaves. And that is to prevent infidelity in them or whatever you want to call it. And also in the women who would take herds out, and they would try to prevent rapes between those girls. So there is one area is, and this practice is still prevalent, and it's more than, like if you look at the WHO site, it's prevalent. They have given a huge burden of about more than 230 women being affected globally by this practice, and young girls are highest at risk, and as they do it in very young age. You asked me about the burden, economic burden. It has a huge economic burden if you go for the treatment, and it's nearly about 1.4 billion per year, dollars. So there is a huge economic burden, and of course, because of related morbidity, mortality, or treatment or management if that is required, and that includes the psychological rehabilitation as well.
Yes.
So yes, it's a huge problem.
This is alarming, this
Yes, it is.
anthropological origin and the historical origin.
It's interesting research if you go and you find those things.
Yeah, I mean, I'm like, it's alarming and
where
it's
it's coming
concerning,
from.
and
Yes.
it's kind of scary as well, and to know that it's still, being practiced in some areas of the world. So, since we know that it's a cultural practice, also people are practicing it in the name of religion as well.
Yes.
Which is, I think, which is not true, like religion wise, if you look at
I
it.
agree with you. So mostly if you look at the global scenario, it's being carried out in the Muslim communities, and not in any other religion, or if there is any, we don't know about it. I don't know at least about it. So its origin and relating it to the religion is wrong.
Yeah.
It's absolutely wrong. And in some of the countries, they call it as practice of Sunnah, or they have their traditional names also. So this is something which needs to be stopped, as it's related directly challenging the basic human rights.
Exactly.
And also SRH rights. Our SDG talks about prevention of child marriages, and also this practice of female genital mutilation. These are the goals which we need to, world has to achieve that goal. So everybody is working on it.
I hope so. So since it's like, coming back to my question, since it's a very culturally sensitive topic, and religiously also, it's sensitive, and people have been practicing it for very long. So as a researcher, what do you think, what are the challenges that will come up when a researcher is conducting their research on FGM? Because we have seen from the past evidence that to conduct research on these sensitive topic needs quite a big heart.
Not heart, skills also. So of course, some of the practices which are very sensitive, especially related to the area of sexual and reproductive health, we generally we are careful. But the FGM is an area which is really far more sensitive than any other topic, sensitive topic related to SRHR, be it gender-based violence. I'm saying this and I'll give you reasons why, or be it the sexual practices you want to learn from adolescents, because these are something which people can realize as bad, and they may hide it, but then of course you may underestimate as a researcher, but these are something which is acceptable. But something if you relate to religion, it gets very challenging.
Yeah.
It gets very, very challenging, and there you need to work on various aspects of research, and especially linking with the people who you think would be involved either in responding or making pathways for you to access those people, kind of thing. Culturally sensitive topic, religiously sensitive topic. So if you want to go for the culture, and even if you think of other practices which are culturally sensitive, for example, if I talk of unsafe abortions, people will not talk openly about it. So if you want to gain some access, you have to develop those linkages in the community. You need to be very sensitive about the community dynamics, that how things are going, and you have to find a person, identify a person whom you can talk to, speak to, and who can help you in making those connections with the people who are willing to talk. So you can get some information. So those are very important things. Second thing is having respect of the problem, respect of the issue. For example, in our scenario, unsafe abortions where occur, for example, if I talk of Pakistani population, these are generally women who are multi-gravida, who are poor, and whose husbands are abusing them. So these are the women who would go as source of recourse for this problem. And similarly is the case with the FGM. It's a very sensitive topic, and people will not talk openly about it. So you have to have those linkages to access these people or to get information on them. Secondly, respect for the practices. Respect for the practices, need to, what is happening there, why they are performing is one kind of research.
Yeah.
And what is their understanding and how they relate it to health, kind of thing. So those are things which you need to keep in mind. Other thing which you can look at, what are the country's policies?
Yeah.
Okay, what is law saying, and who are the people who are making these policies? So there are different things which you need to, even if you talk about medicalization of FGM, then of course the trained people are involved, and they are deeply rooted in that culture, and they will protect that. And
Even
it's
the
again, we will,
practitioners.
yes, sorry, go ahead.
Even the practitioners also.
Exactly, that's what I am saying.
Yeah.
That was I'm saying. So now there is again a secondary counter movement against the stopping of FGM, is that medicalize it and make it less painful for the young children. So that is again against the rights, basic rights.
So I think it's a deeply complex problem. Like it's rooted in religion, it's rooted in culture, and also it's rooted in the back of people's mind that they won't be able to let it go that easily. Even the medical practitioners, even the policy makers, or even the religious leaders. So my next question would be that you mentioned about the community linkages, and to build those community linkages and to build those trust with the stakeholders of the community. So how do you think we should navigate? Because we always talk about stakeholders engagement, we always talk about community engagement, we have frameworks for that. But how do you think, how can a young researcher, especially who has no who hasn't even faced any kind of backlash from the community, should navigate this community engagement part?
Yes, so that's an important question, and I think it holds true for any kind of sensitive research, is irrespective
Exactly.
of FGM, or you can talk about the issues related to SRHR. So as a young researcher, you need some guide. Okay, so there are your mentors, there are your seniors, expert people who have experienced people who have already done this, have been through this. You can learn from their experience. You can read lots of material available, and especially, I mean, we are medical people, so we largely talk about medical issues, but you read a lot about the social sciences papers. And these are the people, these are true people who are really addressing these issues. So you learn a lot from them. So networking, linkaging, identifying the right person, a person who can connect you to the community where you want to go and do the research, other things where you should start with. And you should start as a learner. Your young researcher should start as a learner, not as an expert. Then you won't fall. You will not falter.
Oh, okay. And that's a really good advice and a very heartwarming advice for young researchers. I hope you guys have gotten the gist of it. So
Yes.
moving on to the next question and coming back to the research part, what methodologies can be used to address such sensitive topics and to navigate the social and cultural sensitivities as as you're implementing a research or conducting a research?
So, okay, research designs remain universal,
Okay.
depending on your research question. So, pick up the research topic which is universal, but then you have to see the situation, how you would like to do it. Of course, the qualitative research, if you want to understand the roots of FGM, the practices of FGM are very difficult, especially when people develop some grudges against the researcher, that these people are going against our cultural values and they will utilize in a way which would be harmful for us. It gets very challenging. So there, when we say that you have to develop your linkages, work with the communities before even conducting, sensitize them about your research project, sensitize them first about the issues, the problems, what are the consequences of FGM for the young girls, younger age, and also later when they are in their reproductive age. So if first you sensitize and then you start doing those researches. I know there is a joint program where the UN agencies joined hands in, especially for the African countries, 17 African countries where they are working since 2007.
Okay.
And it has taken a very long time to reach to this stage where they can intermingle with the communities, or identify people who are supportive of preventing or stopping this practice of FGM. But most of them, in most of the countries, not I will say most, but many of the countries, they have not been successful also. So for evaluation and monitoring of their program, they have used different ways. They have not used the typical practices of scientific or research to get those responses. For example, mapping kind of thing, or generally talking to the people who are supportive if they have noticed anything, and then comparing those numbers with the previous numbers if they are keeping those numbers. So that is very challenging. And obviously you can have information from the, if we are talking about medicalization of the hospitals, this data can be available. In some of the hospitals, still countries, it is still legal. So that information can come, and in some of the areas there are very small pockets of these practices, they may not become obvious. So for such cases, we generally say that whatever estimates you give, these are underestimates, because people may not talk about it.
People may not talk about it, and as you said that there are some places where it is legalized.
In countries,
In
African
countries,
countries,
in
we can
African
talk about.
countries,
It's
they
a
are
common
legalized.
practice in certain sects, Muslim sects. It's a common practice. They do it, and in certain countries they may hide it. They may have their own practitioners where they would go and get this practice done on their young children, girl children. So they may not so openly talk to you. I mean, if I'm interviewing you and you want to hide something you don't want to share, you will misguide me, and I'll take it on the face value.
Yeah.
I don't have anything for such kind of topics to really validate your answers. Okay, that won't be appropriate.
Also, exactly, the biases, the
Exactly.
under-reporting, the wish bias, the response bias and everything
Exactly.
would come into
Exactly.
play. Uh,
Exactly.
and also, I think immigrant population would be very much difficult to catch and have a hold on them because they go back and forth from the countries to get the
Exactly.
process done.
Yes, recently this is becoming challenging for the countries, especially UK, Australia, because they don't want this practice to be carried out in their countries. They have all the rights to have those laws or stop those practices, but you can't stop people going back to their home countries. Now, in some of the African countries, for example, Burkina Faso, Benin, the countries have made a law that this is being banned. Now, people would migrate to Mali and
Oh,
go there and have these practices done. So Mali has completely refused. They are not going. They are not putting it a law or anything kind of thing. Currently, what I know things have changed recently. That I don't know. I'm
oh.
talking about what I have read previously.
It's such a cross-cultural,
Yes,
cross-border,
yes,
connected problem that even,
deeply, deeply rooted.
exactly, like European countries and high-income countries are also facing, and then lower middle-income
Exactly.
countries are also facing. That's
Exactly.
kind of fascinating for me, that a problem can just go from places to places, and
Yes.
you are not, no one is able to contain it.
Behavior change, the behavior change interventions, research interventions can bring this change, and this is what being done in the joint programs by the UN agencies in African countries. Like I mentioned, 17 kids. I've read somewhere there are 92 countries in the world where these practices
Yeah.
are being carried out.
Although not very apparent like in African countries and Middle East countries, but we know that it is being
Yes.
practiced in Pakistan also.
Yes, yes.
We know
In
that.
Indonesia, Malaysia,
Yeah.
it's very common in Malaysia, in Indonesia. I mean, this is surprising.
Exactly.
Okay, India. In India, I think in Kerala, and there is one more what do you call it as their province,
State.
state.
Yeah.
Yes, exactly. Where it's very common, and those are again Muslims.
And those are again Muslim
Yes.
countries, yeah. So I think it's very common, like you said, like it's very common in Islamic
It's
countries.
common,
Okay.
relatively common, and
But very hidden also.
very hidden as well, like any other hidden practices.
I think some of the practices we talk about a lot, like, unsafe abortion, we kind of have stats for that for every country. But I think this is something that is very blanketed.
So stats on unsafe abortions may not be true as well. These are again estimates,
Yeah.
and we always say this could be underestimates. Nobody is going to overestimate that.
Obviously.
Nobody. Who will do that? These are the underestimates, always.
Yeah.
So
Interesting.
that is the trickiest point of conducting research in these things. The things which can most work are efforts you make for advocacy for such practices, against such practices, convincing the governments, legalizing, legally abandoning these practices may work. And also, as I said, behavior change. Come on, your country is, the contraceptive rate is so low in Pakistan. This is a matter of behavior change. It's not happening.
Yeah.
Talk about FGM, which is
We
so
have to move from
deeply rooted.
implementation to behavior
Exactly.
change intervention.
Exactly.
I know that. That's my favorite topic. I think we should stick to FGM for now. Okay, so moving on, you talked about collaborations. You talked about there's a alliance or there's a union, or there are agencies coming together to work for FGM. How many programs are there, and what is being done, and what international partners are very much interested in ending this problem?
So, see, the global agenda are your sustainable development goals, okay? And 5.3 is the goal where they talk about stopping the child marriages and also the female genital mutilation. And this actually got the concern became major during the COVID-19 outbreak, when people started, when they were like, people were not earning, they were just strangled into their communities, and they were getting jobless. They started marrying their girls at younger age, and for that to be that girl acceptable from their cultural beliefs, they went for female genital mutilation. So actually the figures they were more as compared to previous. So those are the things, the happenings can also affect that. But I know the UN agencies are really a great job. They are combining hands with the local NGOs, the local partners, especially in the African countries, which I am aware of, and they are, I mean, trying to bring change there. As I said, some are successful, some efforts are successful, some are not, some are very slow in pace, but moving in the right direction.
I hope that we
And then again, I'm not an expert on this area of research. I can talk from the perspective of sensitive research. When you are carrying out what you have to keep that in mind. But this is one big area which is of importance to the sexual and reproductive health of young girls and also of women. And it's the violation, direct violation of basic human right and also SRHR rights.
I think we are done with the questions, but any last thoughts that you might have or you want to say it out loud?
We should achieve the goal of SDG by 2030, which is still far off, but still we are moving towards that direction, and people have started talking more and more about it. But new things will emerge, new challenges will emerge, and of course it's a teamwork.
Thank you,
at the
Dr.
global
Saleem.
level as well.
Exactly, I agree with every bit of what you said. Then, okay, so this was it. We'll move on to our rapid fire questions, the fun part of our podcast, because we have had a very serious conversation. So, I want you to be rapid and I want your answers to be full of fire. So, should we start?
Okay.
So, medicalization or prevention?
Prevention, obviously.
Short term health consequences or long term?
Both are there.
Economic impact on individual or communities?
All.
Okay, so this is my favorite one. Top down legal ban or community involvement?
Both will work. Both will work actually. So in some of the countries there was top down approach.
Oh yeah.
And that has stopped, that has brought the change.
So wasn't there any challenges and
Of course they were,
backlash
of
and
course they
everything?
were. I mean, you are not working in vacuum.
Yeah.
But then if things are legalized, then you can take action.
Oh right.
You can provide support to the young girls.
Yeah.
You can give counseling to the young girls. So it's under the protection.
Oh nice. So again, this is one of my favorite. Gender roles or social norms?
Both.
Both. A community based or clinical based?
What?
The research.
Research. Okay,
Yeah.
so these are okay. This is all related to research, so you have to be very clear.
Okay.
Both researches are required, obviously.
Then health outcomes or social outcomes?
Both.
Both.
Both. Of course, you want to bring a behavior change. You want to see. You want to determine that what changes have occurred. Obviously.
Would you rather face ethical challenges or social challenges?
Okay, ethical challenges, conducting research.
Yeah.
From research perspectives, of course, you have to be very, very ethical. And from social perspective, you need to understand the sensitivities related to and be respectful.
Oh, nice. Would you rather focus on individual experiences or collective narratives?
So, individual experiences for sensitive topics are very powerful.
Individual.
Very powerful.
Yeah.
So if you present those case studies, those are very important. And even when you try to convince the policymakers or to change the law, these case studies are very, very important. And then can form a very nice your policy brief,
Yeah.
can support your policy briefs. So I would say that.
Individual experiences.
Yes, I think so. I think so.
Yeah, I think individual experiences are more personalized.
But of course, choice is researchers'
We know
choice.
what collective narrative is like, but to get in inside depth, I think I also agree with you.
Yes, actually, the pain and of the process they have been through as a young girl, as an adolescent, after getting married, and then if you go for the type 4 or infibulation, which is like sewing the birth canal, and it's opened every time for the birth and closed every time. So just imagine how brutal it is. And a woman who has experienced and gone through this could be the best advocates for this,
Yeah.
for stopping this practice.
But don't you think their stories would be used as sensational material? Because that's what happens when we collect individual experiences. People turn them into sensational.
To certain extent. It's up to a researcher how they would want. Don't exploit that information. Use it for the right purpose.
Okay.
Why to exploit any information?
Yeah.
Even if it's not sensitive, it's related to a disease you are concerned. You don't have to, for example, make it like what can you say, news something.
Yeah,
of,
because
yeah.
that's what we see with. I mean, the voices are amplified, but then they turn into some other kind of material. Yeah.
Well, you will learn with
Yeah,
the
yeah.
age and the experience.
Well, under your
it's
mentorship.
not so. It's not so.
Yeah. Thank you so much, Dr. Sara,
Thank you
for
very much
joining
for
us
having
and-
me here.
Yeah.
Thank you very much. I hope I have made justice to this topic. As I mentioned earlier, I don't have any direct research in this topic, but this is a very sensitive topic, very important topic, as it directly interacts with the basic human rights and the SR, sexual and reproductive health rights, and it hurts children, it hurts young girls, not even as a child, not even as an infant, young child, adolescent, but also as a grown-up woman when she is passing through her reproductive life. So these practices have to be stopped and thoroughly researched as well. Thank you.
Thank you, Dr. Sara, for joining us and for having a very interesting conversation. Like, I enjoyed it.
Thank
I
you
hope you
very
enjoyed the podcast as well.
Thank you.